This segment is sponsored by JIS Orthopedics. JIS Orthopedics has built a reputation as the leader in joint replacement. So today, we're here at the New Albany campus to talk about the patient experience from consultation to total recovery. And joining us now is Dr. Lombardi to tell us all about it. It's nice to meet you, sir.
Nice to meet you too.
So talk about what makes your and your team's approach so unique and beneficial.
Well, joint implant surgeons, as we are originally called, and now we say JIS Orthopedics, was founded in the 70s by my mentor, Tom Mallory. Now, Tom taught me three things are important for practice. The first is excellence in patient care. The patient is the key focus of everyone who's on my staff, because the patient is coming to us with pain, discomfort, change in their lives and their quality of life. And we are going to offer them a change to make it better. So we have to be excellent at what we do. So that's the first premise of a good practice. The second one is education. You have to educate yourself. Read one paper every day on your area of expertise. Not only do you have to educate yourself, when you see a patient, you have to educate the patient on what it is you're offering them. What are you going to do for them? You have to educate their family on what's the expectations, what's going to happen post-op, how are they going to have to deal with this patient after this surgery. You have to educate your staff. They need to be up to date. You have to educate your colleagues. So I spend a good portion of my career traveling all over the world, educating my colleagues on what it is I do. The third thing is research. Now, I'm not saying you're sitting in a lab doing research, but you're looking at your clinical results. Because if you don't know what you don't know, you could be doing the wrong thing day in and day out. So you need to know, are your processes correct? Is your surgery good? Are your patients getting good results? And we do that here, and we present that information across the world.
And speaking of results, talk about what that journey looks like for a patient, from the consultation all the way to the end of recovery.
All right, so I think the first thing you have to understand is that patients come to JIS with hip, knee pain, shoulder pain, back pain. Pain's the obvious driver.
Yeah.
And the major cause of musculoskeletal pain with joint replacement is arthritis. And then you have to evaluate, is what you do appropriate for that patient? I never want to tell a patient they have to have a knee replacement, they have to have a hip replacement. It's a quality of life change.
Yeah.
Is the quality of your life compromised? How many bad days do you have versus good days? Because if the number of bad days outweighs the number of good days, then you need what I do. So once I've decided that with the patient, I review the x-rays with them. I review the implants with them. I show them the metal and plastic I'm going to implant and explain the operation and explain what's going to happen. They then go off and schedule with my scheduler. They then see an internal medicine team, which I want them to see to make sure that I'm operating on a healthy patient. So any compromises in their health program should be corrected. And now we've gotten to the stage where these procedures are same-day surgeries.
Wow.
95% of the people I work on go home within 4 hours of their operation. And I tell them they can resume driving in a couple weeks once they're off of pain medications, because that's usually how long it takes. And by 4 to 6 weeks, they're 95% recovery. And certainly at a year, they're coming back and they're telling you how much you've changed their lives. I've seen patients I've done 20 years ago with the same implant just doing great.
Wow.
They're coming back because maybe I did one hip, now they need their other hip or their knees done.
Dr. Lombardi, I know you're a busy man. You got tons of patients today. Thank you for telling us all about this.
Okay, great.
And if you want to find out more information, if you're struggling in any sense with your joints or any other area that JIS can cover, you can find out all the information at jisortho.com.